Okay, so to be mindful of time, I'm going to go ahead and get started. So my name is Lindsey Helvaty. I am the clinical research manager in cardiovascular genetics within the Department of Pediatrics. And I am giving a talk today to let you know about a patient clinical registry that we started within our program. And then I'm also going to talk about repeating instruments a little bit because it's something that has been really useful in the way that we capture our data. So kind of went over that. So I'm going to give some background with our group, why we created this registry, the issues we had getting it set up, and then move into kind of the differences with the way that the data is captured and you export between a long format and wide format, and then the repeating instruments. So just to give some background, so the cardiovascular genetics program is a clinical program that is at IU Health. We see both pediatric and adult patients, and the patients are basically seen because their cardiac condition potentially could be inherited. So we have a multidisciplinary clinic set up where all patients potentially could be seen by a medical geneticist, a cardiologist, and a genetic counselor. And then I also included our pulmonologist because we also have a pulmonary hypertension clinic, which specializes with having the pulmonologist in the clinic with them. All of our patients are either seen on inpatient consults. So if we have newborn babies that are seen, they may consult a geneticist to come make sure that they don't have any kind of genetic condition. Or they're seen in very specific clinics at IU Health and in the patient, the PAC, the new area that they're seen in. So these are the list of the different clinics that we have. So we see patients that have aorta issues, so aortopathies, arrhythmias, cardiomyopathies, congenital heart defects, which is mostly our inpatient consults, and then pulmonary hypertension. And then at Methodist is where we have our lipid clinics. So like familial hypercholesterolemia or something like that. So the general setup of these clinics, so usually the kiddos will come in, they'll have cardiac testing, so an echocardiogram, some sort of cardiac imaging to see if they have any kind of like growth of the aorta or what the congenital heart defect is. And then they'll come into the clinic and the genetic counselor will take a 3-generation pedigree. So it's to start to kind of understand if other members within the family have any kind of cardiac issues or genetic issues that could be of concern to let us know that maybe we are dealing with an inherited disease. Then they are given a physical exam both by the molecular geneticist, so who's looking for like dysmorphologies, and then also by the cardiologist to listen for any kind of like, you know, arrhythmias or listening for murmurs or whatever. If they determine that there's a need for genetic testing, then they're counseled pre-genetic testing to let them know about the implications of what genetic testing means, what potentially could be found, secondary findings, those kinds of things. And then ideally, if everything goes well, we actually have a diagnosis for the patients. And then with diagnosis, a lot of these patients could then potentially have activity restrictions. So if they have an enlarged aorta, they potentially might not be able to do heavy weightlifting because they have a chance of the tissues of the aorta ripping and bleeding out, things like that. Medication management is a huge piece of the cardiologist. And then we also do cascade screening, which means that if we say, hey, we found this specific cause to your aortopathy, and we think that this is inherited, then we need to talk about to like everyone in your family that's like a 1st-degree relative or maybe 2nd-degree relative to make sure that they don't have this disease or couldn't pass it down to their children. So I give you that background to then know. So from a clinical perspective, our doctors wanted to be able to look at their patients from a longitudinal standpoint, but all of the data at IU Health is stored into Cerner. Are most people familiar with Cerner here? Yes, okay. Cerner's not great. So it does not really allow us to store data in a very usable fashion, especially a lot of the things that we utilize. Like I said, that cardiac testing, the genetic testing. So right here, what I have is an image of what a standard echocardiogram report would look like. So the testing is done in an outside software. They add all of these fields that they want from that, and then they import it into Cerner in a PDF format. So when you're thinking about trying to look at this from a clinician standpoint and you're looking at longitudinal data, so what does my aortic measurement look like from the last 3 visits to now? You're going to have to pull up 4 echocardiograms looking at those data, right? So this isn't usable for clinicians, especially when they're trying to prep for a patient before clinic. So another example, so this is what a genetic testing report looks like. So the lab that you send the genetic testing to will basically send you this report and it'll tell you very important information details. So just kind of showing you a couple things. Can you see my cursor? Yeah, okay, cool. So this is letting you know, so for this first line, this patient was found to have a pathogenic variant. So what this means is that this specific change within their genetic makeup is causing the disease that they have. So this was sent out for an aortopathy panel. So they were concerned that this patient might have a genetic condition related to their aortopathy. And they found this specific change within this FBN1 gene. And so this means that they found the cause of the disease. And so then this has the implications that, again, we would want to do cascade screening. We probably have to have medication. If they haven't had some sort of surgery to repair the aorta, they're going to have echocardiograms on a yearly or every 3-year basis to make sure that they're okay. So again, look at this format. This is not useful when you're trying to have patients potentially. They might have had like 3 other types of genetic testing before they went to this panel. So to be able to totally understand the genetic makeup of this patient, you need to look at multiple PDF reports. And then if you want to think about the clinic in a bigger perspective, how many of our patients that we see here at IU Health have this specific variant within the FBN1 mutation? There is no way to look into Cerner and get that information. So we started talking about, well, how do we do this from a clinical perspective? How do we actually capture this data? And so what I'm showing you is kind of a little like spoiler of what we're going to get to. So this is actually a live filter that we have created within our clinical registry that allows us to look at data in a longitudinal fashion. And then again, this is a nice dashboard from REDCap to look at the genetic testing results for one patient, but we can look at multiple as well. So we were like, we probably can use REDCap, but this was in 2017 when we started brainstorming this. And so the first thing we did, we went to the IU IRB and we said, is this research? And we said, do we need to actually consent patients to be entered into this clinical registry? But the caveat being, if someone decides they don't want to be in the study, then they won't be in this database. So if this is a clinical tool, then that's not an option. And so the IRB said that if this is a truly clinical tool that's going to be used by the clinical providers, that this would not be considered research. We would not have to get clinical consent. But if we ever wanted to do research using this data, then you need to submit a specific study on the specific cohort that you're interested in. And then the only people who can access that data are the people in the study, right? So we're like, okay, cool. So we're covered from a research perspective. The next step was talking to IU Health. So research is done under IU School of Medicine, which is a separate entity from IU Health. IU Health owns the data. So Cerner is an IU Health tool. And so IU Health was like, no, you can't store clinical data outside of Cerner and software that we haven't approved. So then we sat and waited. So IU Health and IU School of Medicine talked, had legal meetings, and in the end of 2017, they signed what's called a BAA, I think it's a business associate agreement, to basically have an agreement that yes, you can now store this clinical data to take care of your patients within the REDCap database, go to that, with a compromise. So we were allowed to have the database, but if you notice at that bottom part of the screen, we have IU Health REDCap admin on our study, or not our study, sorry, I work in research mostly, on our clinical registry. And so this basically allows them to monitor. So Chris Groves, who I think I saw walk in, is on here. So he technically is monitoring our study just to make sure that we're doing what we said we were going to. And so that's kind of like the compromise. So I just want to note this because these clinical registries are awesome tools, but you just want to make sure that you're going through it the appropriate way and you're not just starting these without having the appropriate oversight, because that will potentially get you into trouble. So we did create this clinical registry, and I just wanted to give like a quick snapshot that, again, getting back to the fact that Cerner, a lot of our data is coming from these PDFs, and also there's just not a really good tool to pull data from Cerner into the database. We do a lot of manual data entry, so you have to have available staff to be able to do this. we've been really lucky. So there is a Master's of Genetic Counseling program here at IU, and we have a lot of work study students who work with our group. So that allows us to kind of just have them specifically work on pulling data for this database. And then some of the more like specialized data. So we do very detailed cardiac phenotyping, which I won't go into, but that's something that me and one of the cardiologists do. And then the genetic counselors do a lot of the data entry for the family history. So it's definitely a collaborative effort between having people that we pay to do it and then utilizing the clinical team to make sure that we keep our database up and going. And I just, again, wanted to note that we have a lots of rules about how we collect our data. And that's because if you want to actually be able to use this for clinical care, and then if we want to pull it for research purposes, we need to make sure we're following rules on how we collect the data, because someone may interpret one data field in a very different way. So then if you go back and they're like, well, what about this? Like, how are you collecting it? You have these moments where you're like, oh, that's a really good point. And now we need to go back and collect this data again. On our database is almost at 4,000 patients now. So that would be a pretty big undertaking. So rules. So our registry currently, like I said, we're almost at 4,000. I looked today, I think it was like 3,900 and something. And so this just gives you a quick overview of the different groups that I was telling you and how many we have in the database. So in that second column, that was the patients that were seen in clinic in 2022. And then our far right column is total. I will note that the bottom row there, incomplete data entry, 848 patients. Our methods are not perfect, and a lot of times we're using this with certain providers who are more interested in utilizing the database. So some people are entered into the database, like they're registered to come into our clinic, and then maybe they no-show, or maybe no one ever went in and actually marked their area of clinical concern why they were being seen in our clinic. And so again, this really speaks to the fact that we need better communication between Cerner and REDCap with data pushing so that we can have more complete data entry. And our hope is that in the near future, there are new tools like the Clinical Data Mart with APIs. Things are advancing. And so hopefully these will be things that will be available to our different teams of actually getting data in here quicker, better. So I would now kind of want to switch to just give some information on so going into a previous research database with the structure of how the data used to be in REDCap, the issues that we had, and then speaking to repeating instruments and how huge these have been in collecting both our genetic testing data and any of that longitudinal data. So right here, I have a data dictionary from one of our research studies that's showing you, it was a pretty simple form that we were collecting where we wanted to know what the free text diagnosis of a patient was, and then what the ICD-9 code associated. Anyone in the medical world knows ICD-9s are no longer a thing, so that states this research database. But what I'm showing you here is that these two fields were repeated in our data dictionary 45 times because we had a patient on our research study who had 45 medical diagnoses that we needed to track for this research study. So we had to go back multiple times and update the database because before repeating instruments existed, you had to know how many times you needed a field within your database. So it definitely made it difficult and required a lot more upkeep in the data build. And then for people who like to use the online designer, I just wanted to give a quick snapshot of what that looked like if you were building the database within REDCap. So again, if you kind of pay attention to the way these are coded, you can see like diagnosis 1, diagnosis 2, diagnosis 3, right? So repeating. And like I said, you have to know how many instances you need to build that database. So then this was the same research project, but this was a much more complicated form that we needed. That was chromosome microarray data, so a type of genetic testing that we did. And what we have here is the form, the genetic testing form, what would now be a form, had 23 fields. But we had a patient that had 65 different findings because they had what's called a region of homozygosity. And so we had to repeat these 23 fields 65 times, which wound up making up 1,495 of the 1,653 fields. So 90% of our data dictionary was repeating this form over and over and over again. So not only was this like a huge hassle in building it, but it really, really slowed down our database. we had to, Martina Bowers, did not say her name right, but she helped us a lot with this database because it crashed all the time. And we were the first ones to build such a large database. This is a multi-center trial. And it had a lot of data in it. And then again, showing you the snapshot in the online designer. So another issue that we had when we were building this was the filtering logic. Have a lot of people in here use the reports feature within REDCap? Yeah, okay. So you basically are using like Boolean language, ands, ors, having to use parentheses. So this is an example of a query that we were doing, trying to see how many patients had this specific change, this 22q11.2 duplication. So the way that this is structured in the database is that that first part is what's called a cytolocation. So we said that that part had to start with, and then they could have a gain or loss, and the duplication would be a gain. But again, as you can see in the filtering logic, because that data potentially could have been in 65 fields, when I was building the report, I had to repeat those 2 fields 65 times. And if you tried to do it using the simple logic within REDCap, you don't get the parentheses in the right place. And so it failed. This didn't work. I wouldn't get the filter that I would want. So this is when I first became very acquainted with my advanced logic feature within REDCap and had to build this. So this is what gave me the answer for how many patients within my database had that specific gain at 22q. It was difficult. So this is what it would look like once you actually ran the report. So out of the 2,000 plus records in there, there were 31 patients that had a duplication. But another issue was because it could be in any of those records, you can see, I think I put it here. You've got the first field for them is a totally different finding than what I wanted. And then their second one was that 22q. So you're going to have to look at the data in a different direction. Oh, and then right here with this accurate thing, all I'm trying to show you here is there is a downside to the repeating instruments. So when you pull that report within the REDCap instance, it tells you how many results it's reporting back on. So this one had 31, which is an accurate number. So just note that, because when we get to the repeating instruments, that does not report the accurate number. And so if I export this out into an Excel document, you can see again, the yellow columns are those gain loss, and then the cytolocation is in the orange color, and the bolded ones are the ones that are actually of interest. So if you want to make sense of this from like a biostats format, how do you do this without having someone who has some sort of coding experience, because you're pulling data from a bunch of different columns? So moving into repeating instruments, this is a huge feature for REDCap. I love it. This has really changed both our research and our clinical data. So what I'm showing you here, different project, but so for the clinical registry, this is our echo data. So these are the different fields that we're interested in on an echocardiogram within our database. And I only have to put them in my data dictionary one time. I don't need to repeat them. And then what you're then going to want to do, so sorry, I'm not going to do an online module because our clinical registry, our study IDs are MRN because it's not a research study. So I can't show you that. I did create a little mock one, but it's not as cool. So I could potentially show you things, but I can't show you the main database. But so I tried to make this kind of easy to go through. So if you're in your project setup, if you go down to the enable options and customization, there's the option to turn on the repeating instruments. So I think it originally says the enable, like that thing's under. So you would just click that. And then it's going to pull up all of the instrument names that you have within your data dictionary or online dictionary. And what it's going to give you the option to do is turn it on to a repeating instrument. So you just check the box, that field becomes green. And then what also is really cool, that right-hand column allows you to put any variables that you want to see in your patient dashboard, which I'll show you. So this is a really cool thing when you're looking at snapshots of your patients. And so, I just wanted to point this out because there's inconsistency with how they report this. So the instrument name on this repeating instrument thing that you're choosing is the same thing as your form name in your data dictionary, okay? So moving on, so if you were going to build a report with the repeating instruments, Again, I don't have to repeat any of my fields. I can just say my echo equals abnormal and that my dilation field does not equal blank is what I've built this report here for. But what I'm pointing out with the circled on the top thing on the step 3, there is the option to show data for all repeating instruments and events, or you can unselect that. That's going to be important because you're going to have patients that have longitudinal data in here. So a patient might have a normal echo, normal echo, normal echo, abnormal. And so if you are telling it you only want to see abnormal echoes, if you have that box selected, if you look down at this, sorry, let me get the mouse again, I know these are kind of small, but what it's showing you is that, so this patient, this is all one patient within this report. So these are all normal ones from that patient, and then here come the abnormal echoes. But if I uncheck that box, I have less results that show up, and these are all abnormal. So you just kind of have to be mindful of that specific feature. Otherwise, your the way you want to see the data might change. Okay, so this is me exporting out echocardiogram data. And so I'm just kind of trying to show you that the visualization of this is going to change dramatically from what you would have seen before. So I think I actually created a legend for us here. Did I? No, I didn't. Sorry, it must have been another one. So this is we'll call patient 1, patient 2, patient 3. So their data is going to export out onto multiple rows, but then you don't have repeating columns. And then you can see that this was my repeating instrument here. So it's exporting it out. Actually, I think I did another one that was more complicated that has the legend to show. So maybe we'll move to that. But the thing that's nice here is now everything that's related to, we'll say, you know, if the echo is abnormal, is all in one column. So in Excel, I, as a lay person, can now filter my results easily and don't have to worry about trying to move multiple columns into one, which is nice. So this is again, so showing another like filtering logic. So what I wanted to point out here is that, so say we turned some of our forms onto repeating instruments and some stay as like a one-time non-longitudinal thing. You can only filter one repeating instrument within a report. So I can't put, so if I have my echocardiogram and my clinical genetic testing results all have reporting things, I can't query by repeatings from each, or it'll fail. So any of those things, you basically have to create your starter filter, I guess, within the report and then export it out into Excel. And then you can do more, you know, filtering down through your filters within Excel. Okay, so this is the one that I created with a legend, because it does start getting, your data export starts looking a little messier once you get into this, because your repeating instrument will show here. So this was all stuff from my clinical genetic testing results. Repeat instrument 1, 2, 3. So these are the different findings for the different types of testing they've had. And then here is our echocardiogram data, which then, as you can kind of see how the variables spit out, they like group together. So then you have a lot of blank data that sits in your spreadsheet for the other pieces. So again, if you're trying to filter within Excel, you still can't really filter between the repeating instruments, because if I were to like put a filter here and say, show me everyone that had a panel, when I put that filter in, it's going to close out all of these other fields because they're blank. Or sorry, here, they're going to close them out so it'll be blank, and then I won't see any of the other like cardiac data that's associated with it. So here, I put our solution for this. So we had to hire a data analyst recently because we have so many research databases. We have this clinical registry that we're trying to use for a clinical tool. So you need to have more sophisticated personnel, hire somebody who has more sophisticated skills within software to deal with really large databases. So all that to say, or you need to hire, like someone on your team needs to then be trained in doing that. Okay, so really quickly wanted to just go through the user interface and the cool things about this. So here's one of our forms, echocardiogram form, that repeats. So this is what it looks like within REDCap. So this is our form if we wanted to add data. And then you can either, if there's already repeating instances in there, you can come up here and hit this little arrow, and it's going to show you all the different ones that you have entered for that patient. And then once you're done entering a new instance, it gives you the option to basically save and close out your form or open a new instance to open another data form. And then the really cool feature here is a record dashboard. So if I were to click on one of the patients within my records, so my little test patient, it'll show me all of the forms that we have in there, but it also gives me underneath that this snapshot of all of my repeating instruments. And this is where, when I was showing you the picture of like you can put the variable names when you're setting up your repeating instruments, that's how I got all of this information. So I told it that like for all the clinic data, I want to know the date that they were seen and what kind of patient they were and who their provider was. And for the genetic testing, I want to know what kind of testing did they have? What were the results of the testing? I don't know if I put anything else in there. But so this is totally customizable. And this is where the clinical utility really comes into play, because a provider could go in here and quickly say like, okay, I'm curious what's going on with their like echo findings. Okay, so it was back in 2018 when they started being abnormal, it continued to be abnormal. And I see that they have a variant of unknown significance or whatever. So they can like quickly get a snapshot, remind themselves of this patient, and then move on to actually seeing them. And then there's this feature that is a live filter. So in the reports within REDCap, you can do what's called a live filter. And so you set up your report normally, so have the same options as adding the users, putting whatever fields you want to show up in that. But then if you ever paid attention to after the filtering option, there's this live filter. And so for me, the MRN is my patient ID. So I've set it up to live filter with my patient ID, and then I've ordered the results. And for this one, I want to do an echocardiogram. So I want it to show me the MRN, and then I want the date of my echo, and then put it in the ascending or the descending order. And then when you are seeing the report in there, you have this option here where you can like want to look through your report. So for clinical utility, they could put the MRN of the patient that they're interested in whenever they want to run the echo. Any new echo results that we've put in here are going to be visible to them. They can see then all of the different measurements, assuming they were in here, which they're not always, because again, we're still working on this. But it's a really nice tool to be able to get a nice snapshot of your patient and for any of the data fields that you have in your database. And if we wanted to search this also by not maybe a specific patient, but somebody who had, going back to the genetic testing results, someone who had a specific variant, we could search that. It would show us all of the patients that have that variant added in there. Okay, so in my last little bit, I'm going to really quick, because I talked about translational research in my title. So something that is cool about the clinical registry is we do have the option to then generate really cool research questions and then submit those IRBs and do research studies. And so just showing you this again, remember, we've got all these areas of clinical concern. We have this wealth of information. I've got 835 patients with cardiomyopathy. So here is an example of one of the projects that we've done so far. So not going into too much detail, but there are patients that have connective tissue disorders. Some of the most common ones that may be more familiar, like Marfan syndrome, Ehlers-Danlos, Loeys-Dietz. So these are types of syndromes that have been identified that they have this like grouping of different features, and they found genetic causes to a lot of these, but then they have concern for aortic dilation and potentially dissection. And so what we wanted to know is these patients come into our clinic for a diagnosis. I've got these features. Do I have Marfan syndrome, for instance? And so sometimes they'll come in and we'll find out that, yeah, you've got some of the features, but you don't meet clinical diagnostic criteria. You need to have 8 of these, 12 features, and you only have like 5. But you still have features, right? And so since we haven't identified a syndrome, does that mean that they don't have a condition? And it doesn't. And so the patients that get the diagnosis of like a Marfan syndrome, there are like set guidelines where they need to have their heart monitored because they're at a high risk of having that dissection. And so for the patients that don't meet the clinical criteria, we don't have any guidelines that say, well, but you should still come back and be seen every 3 years just to make sure that you don't have any change to your heart. And so our question essentially for this project is, what is the CTD NOS, what we're calling them, these people who have certain features, but they don't meet diagnostic criteria, what does this look like? And do we need to potentially be, encouraging the general, cardiac guidelines to change to where these patients should be seen on occasion, perhaps for surveillance of their aorta. And so for this project, we submitted an IRB. And just note that again, right? You have to follow the appropriate procedures, even though it's a clinical registry and we have access to this data, we need to make sure that we're using the research appropriately. The study was considered exempt because it's an observational. We're not taking any samples or anything from the patients. And so then, I wanted to show you these custom record dashboards. Has anyone used these? Yeah, not many, but some. These are really cool. So it's kind of the same logic of using your filters, or I'm sorry, your reports, like the filtering within your reports. But instead of it spitting out data for you in that format, you can build them so then it creates these dashboards. So instead of your default dashboard that shows everyone within your REDCap database, this has the specific filters for just the group that you're looking at. I use these all the time to have our team collect data. So I'll be like, we really need to get all of the genetic testing entered into the clinical registry for our cardiomyopathy population because we know we're going to do a study on it soon. So I can create this dashboard that says everyone who has an area of clinical concern that's cardiomyopathy, whatever, can go in here. And then I can pick the specific instruments that I want data collected in, and I can leave others out. So this is a really cool tool. So we did this. That's spitting out really funny on your end too. Sorry. But basically, you can't see any of my numbers. This looks weird, but we did a phenotyping of this population and found that, let's see if I can see my numbers. I can't. It was about, no, that's not gonna work. Anyway, the biggest majority of our population seen within these clinics is that CTD NOS, huge population. Basically coming in, they have features, they're not getting diagnoses. And then we looked at it further, and of the patients that are in the CTD NOS group, 29% of them had thoracic aortic dilation. So they haven't had a dissection yet, but they have dilation. That's a pretty big percentage of that population to not have guidelines that need to be followed for them to come back and have any kind of surveillance of their aorta. So we submitted this as an abstract to the ACMG, presented it there, and then we've collected an additional about a year on patients, and we're in the process of doing a publication on this. And so hopefully we'll be able to make a change, and maybe they'll put some guidelines in place for this population and we can study them further. For my acknowledgements, I just have our cardiovascular genetics clinical team, and then everyone who worked on that paper with us, and everyone who does our data entry and all that good stuff. So with that, are there any questions? Okay, so the question was, do I know of any other groups that are using a, basically collaborating between Cerner and REDCap? I know that they're testing, you mean to move data from Cerner into REDCap? Oh, good question. So I do not. I think that the majority of registries are done in a research basis, to where there's actually like that research component, because I think most registries are usually funded through large organizations that are looking at a specific disease. But my guess is there are people who are utilizing this, they just didn't go through the appropriate, ways. I mean, I think like IU Health is certainly aware of the fact that clinical data is stored all over the place. I don't know how many providers I know that have their like 5 one-off Excel sheets that they keep on this specific population of patients because they want to look at it. And so what we're trying to show is that you can do it in the proper way to make sure that we're protecting data better. And then, our entire clinical team has access to this. It's not just one PI who's collecting their own patients. And again, then becomes a much richer resource for us to then ask questions and do research. So to answer your question, no, I don't know. Any other questions? No? All right, thank you so much. And if anyone does think of any questions, feel free to reach out to me.